over 90% of people who have thyroid conditions have an autoimmune component to it. So if those antibodies aren't checked, you're never going to know that. You're going to continuously dump this into your body expecting for these symptoms to go away, and guess what? It's not going to work. Hi, today what I'd like to speak to you about is a very commonly misdiagnosed and underdiagnosed condition, which is conditions involving the thyroid. Every single cell in the human body has thyroid receptors. So if we have any problems with our thyroid, if it is malfunctioning in any way, every system in our body can be affected by it. So many times conventional medicine takes us down the path of checking one simple hormone level, which is your TSH. And we're going to go over in a minute what that TSH is and why it's important, but it's not the only thyroid hormone we should be looking at. So the thyroid, it is a butterfly-shaped organ, lives right here in our neck, and it is controlled by the pituitary. So the pituitary tells the thyroid what and how many hormones to produce. It does this through a hormone called TSH, which is thyroid stimulating hormone. Now, very, very commonly, you probably have a thyroid condition. That's what brought you to this video, and you've had this value checked by your doctor, and they've told you, I've checked your thyroid and it's within normal limits, or it's okay. Now, the problem with this is, if the problem is here, that's great. We'll catch it on the TSH. But the other problem is there's still a lot more that is involved in getting the thyroid to work properly. So let's talk a little bit about once TSH is put out by the pituitary, it tells the thyroid to produce a type of hormone called T4. Okay, so T4, unfortunately, is an inactive form of thyroid. Our body cannot use that. All of those cell receptors cannot use T4. It's considered inactive. Okay, so you might ask, well, how do I get it to become active? Well, that's a good question, and one that goes very commonly overlooked. How that gets activated is in the liver and the GI tract. So liver and in our gut or GI tract. Okay, so this is where it's converted to T3, which is our active thyroid hormone, and that's the one used by all the cells. So if we have any problems in our liver or our gut, leaky gut, there's a huge trend right now of people addressing leaky gut syndrome, and for good reason. It's for great reason, because if you have leaky gut, that means that if this isn't working, well, guess what? This part isn't happening. That conversion is not occurring. So this is where we have the problem with synthetic drugs, things like levothyroxine or Synthroid. Oftentimes, if you have anything off on your TSH, the first thing your doctor does is gives you levothyroxine or Synthroid. So that drug is actually T4. So if we pump T4 into the body, well, guess what? If your liver and gut still aren't working, it doesn't matter how much inactive thyroid hormone you're given. Your body still doesn't have enough active T3 to actually make the changes in your body to waylay your symptoms. So it's important for you to understand you may be experiencing symptoms continuously despite even being on thyroid hormone. So let's talk about that for a minute. So symptoms that may go with thyroid conditions are widespread. They reach every organ in the human body. So it's very hard to narrow down whether a symptom is directly connected to your thyroid. It really takes some investigation to figure out that it's a thyroid, because we can see how complicated this thyroid chain is going to be. We can't just stop at step 2 and figure that there is or isn't a thyroid condition. So some of the symptoms you may be experiencing: fatigue. Fatigue is a symptom that can go with many different diagnoses, but The first thing that people usually come in, if they're coming in saying, hey, I'm tired, I wake up tired in the morning, I have no energy by the end of the day, I'm 100% dependent on 5 cups of coffee every day to get me through. Those are symptoms that make me think like, hey, wait a minute, has your thyroid been evaluated and not just checked? I'm not talking, has your TSH been checked? Has your thyroid truly been evaluated? Has this whole system all the way down to, do your cells have enough T3 to function properly? So fatigue, very common symptom we see people with thyroid conditions coming in with. Depression and anxiety, again, another one that oftentimes more drugs are thrown at you. Take this antidepressant medication, maybe that's going to help you. Well, guess what? If it's your thyroid, that's still just masking something and usually creates even more symptoms as side effects of those drugs. Weight gain or inability to lose weight. So people come in and tell me all the time, I've tried everything. I'm working out, I'm eating right, I'm doing what I'm supposed to, I'm doing this exercise program, but I just can't get these stubborn pounds to go away. That is a huge signal for me to look at. Liver, gut, is your body able to convert this into active thyroid hormone? Do you have enough active thyroid hormone to allow your body to release the excess fat that it's storing and use for energy? Constipation and diarrhea. A ton of people suffer from GI upset that's treated with antacids or treated with Tums or treated with Pepcid or the little purple pill. Constantly these drugs are given to people to mask a symptom. Well, if your thyroid is really the root cause of that, it doesn't matter how many purple pills you take, your stomach and your GI tract are actually being worse for the wear by taking those meds, because guess what? You're eliminating its ability to convert that to an active thyroid hormone, which is in turn just making the symptoms worse. Frequent infections. So a lot of times people don't relate their immune system to thyroid conditions, but it's a very, very close connection. All of those cells we talked about having thyroid receptors, your immune system is a huge part of that. People who get frequent colds, chronic sinus issues, constantly on antibiotics, constant sore throats, things like that. When I hear some symptoms like that, it always makes me think like, hey, we need to check out the thyroid and see if there's something going on that's precluding that immune system from doing what it's supposed to do. So while we talk about immune system, I want to talk about autoimmunity. So the word auto means self. So an autoimmune condition is where our body is actually attacking our own cells, but it's not supposed to be. So obviously our body has all of us have a thyroid, and our body should know that the thyroid belongs to us, but sometimes things happen in our life, whether it's environmental toxins that we're exposed to, or a weakened immune system, or side effects of medications. A lot of times our body goes a little haywire and it starts attacking those cells. It kind of marks them with a star and says, hey, that's not supposed to be there. Well, when that happens, it's very hard. We can't get away from our thyroid. It's in there. We can't get away from our immune system. It's there working all the time as well. So autoimmune conditions, and you may have heard this terminology before, Hashimoto's disease, Graves' disease. These are terms that describe an autoimmune condition that's attacking specifically the thyroid gland. So when we think of that requires a different steps to treat that. We have to fix the immune system. The thyroid's an innocent bystander in that. Sure, your thyroid hormones are off because your body's attacking your thyroid, but the true reason it's off doesn't have anything to do with your thyroid functioning. It has to do with your immune system attacking your thyroid. So what I want you to understand is that you can't only check certain things along the way here and expect to get these symptoms to go away. You have to have a comprehensive thyroid panel evaluated. And I'm talking about the hormones here, the hormones here, the hormones here. Autoimmune conditions are diagnosed by looking at certain antibodies. So those antibodies have to be tested. Over 90% of people who have thyroid conditions have an autoimmune component to it. So if those antibodies aren't checked, you're never going to know that. You're going to continuously dump this into your body expecting for these symptoms to go away, and guess what? It's not going to work. So I encourage you, if this is you, if you're suffering from these symptoms, if you've been told you have a thyroid condition and you're on Synthroid, but you still are having these symptoms, please get evaluated and let a person who has knowledge in a comprehensive thyroid evaluation take a look at you. So in our office, when you come in for a consultation, you meet with one of our thyroid specialists, and we go through a complete history, a look at what medications you're on, how long you've been on there, dietary. We look at, how your liver and your gut are functioning at present. We take a full history, and then we do an extensive lab panel. And that's the most important thing. We want to get to the root cause of why your thyroid is not working. We don't want to just slap another drug on you. We want to get you off of those drugs. We want to approach it at the cellular level. We take every thyroid case not just as you are a thyroid. We take it as you are a whole person, and we want to make sure every cell in your body that needs those thyroid receptors to be working, that it is working, and that your body is able to heal and protect itself. So I encourage you to please get evaluated. If this sounds like you, please get evaluated in a comprehensive manner.